Cerebral cortex, lesion, lateral medullary ischemia, Wallenberg syndrome, spinocerebellar tract is compromised, right-sided cerebellar ataxia, patient cannot walk in straight line, keeps on falling on same side, heel shin test positive on same side, feedback mechanism of cerebellum on the cerebellum, feedback mechanism of cerebrum on the cerebellum, using corticospinal cerebellar tract, CPC tract. CPC tract is using the middle cerebellar peduncle. Right lower limb proprioception. Right dorsal spinocerebellar tract, mossy fibers, passing through inferior cerebellar peduncles, reaches the granule cells in the cerebral cortex. Granule cell communicates with all other types of cells in cerebellar cortex via parallel fibers. Purkinje cell sends information to dentate nucleus, dentatorobrothalamic tract using superior cerebellar peduncle. Crosses the midline, left-sided thalamus, left cerebral cortex. Two types of fibers comes into cerebellum through the inferior cerebellar peduncles. Dorsal spinocerebellar tract, also known as mossy fibers, olivocerebellar tract, also known as climbing fibers. Only Purkinje cells can communicate with deep cerebellar nuclei. Granule cells uses parallel fibers to communicate with other cells in the cerebellar cortex. Lesions of cerebellum. In cerebellar lesions, proprioception of lower limb is compromised. Heel shin test will be positive. These patients have wide-based gait because they have the tendency to fall on same side as of lesion. Cerebellar ataxia. Heel shin test. Patient is asked to move his or her heel in the shin in a straight line. If the patient is unable to move the heel in a straight line and heel instead of goes zigzag, the test is positive. Heel shin test is patient is asked to move his or her heel in the shin in a straight line. If patient is unable to move the heel in a straight line and the heel instead goes zigzag, the test is positive. Spinal cord, hemisection of spinal cord, Brown-Sequard syndrome. Columns injured in Brown-Sequard syndrome. Dorsal columns, ipsilateral loss of tactile discrimination, vibration and proprioception at and below the level of lesion. Spinothalamic tract, corticolateral loss of pain, temperature and crude sensations. 1 to 2 segments below the lesion and ipsilateral loss at level of lesion. Dorsal spinocerebellar tract. It causes cerebellar ataxia in patients with Brown-Sequard syndrome. Heel shin test is positive on ipsilateral side of body. Patient keeps falling on same side as the lesion. Corticospinal tract. Ipsilateral spastic paresis below the level of lesion. Lower motor neurons. Flaccid paralysis at the level of lesion. Transverse section of spinal cord. Posterior or dorsal column. It carries conscious proprioception, vibration, pressure, touch, deeper and discriminative touch and stereognosis sensations from ipsilateral side of body. It has two fasciculi, fasciculus gracilis, fasciculus cuneatus. Anterior ventral spinothalamic tract. They carry pressure and touch sensations from the contralateral side of body. It carries the light touch and the crude touch sensations. Lateral spinothalamic tract. They carry pain, temperature sensations from the contralateral side of body. Dorsal spinocerebellar tract. If compromised, it leads to cerebellar ataxia on same side as the lesion. Corticospinal tract. If compromised, it leads to spastic paralysis below the level of lesion on the ipsilateral side. Pyramidal tract. It is required for fine and skilled voluntary motor activity. It has two